Hey guys, when taking your NCLEX exam, you will stumble upon at least one of the inflammatory heart diseases at some point. And I guarantee this, the thing about cardiac diseases, especially inflammatory uh, diseases, is that we don't really fully look at the diseases as a whole, or at least trying to make a connection between each disease to fully understand the bigger picture. Because when we do look at the whole picture, it's easier to simplify the differences and the correlation between the inflammatory diseases. Now, first, let me ask you this. Do you know what inflammatory heart disease is? It's basically it basically pertains to the inflammation of the heart muscle, right? Which is usually due to an infection that develops from either a bacteria or a virus. Now, take note that this type of inflammation is often associated with episodes of rheumatic fever, right? And another one is a big one is Kawasaki disease. Now, those two are very important to know for your NCLEX because those two diseases, if untreated, leads to inflammation of the cardiac muscle, right? And the cardiac vessels. And it's a very, very bad thing. Now, the three inflammatory conditions that you might mostly encounter in your NCLEX exam can be classified as either pericarditis, myocarditis, and endocarditis. Now, first, let's go back to our anatomy because this can help us understand these conditions in a more simpler way. Now, the heart wall is comprised of three layers, right? The outer epicardium that covers the pericardial layer or the pericardium, right? The middle myocardium layer, and the inner endocardium layer. So it's important to mentally distinguish between the pericardium, your myocardium, and the endocardium layers of the heart wall. So again, the pericardium is the thin layer of connective tissue and fat and serves as more of like the layer of protection for the heart, right? And it's the outside layer. Under the pericardium is the myocardium, which is the muscle tissue of the heart, and it's usually composed of the cardiac muscles, right? And these muscles contract, and the conduction of electricity coordinates with the contraction, right, for the muscle. Now, lastly, the inner layer or the endocardium, right, is composed of endothelial cells, and it's also composed of the smooth muscle of the heart and the vessels that connects to the valves. That's why when we talk about an endocarditis infection, it is sometimes referred to as an infection of the heart valves, right? So again, a good way to remember this is that the pericardium is the sac or the outer layer, the myocardium is the middle layer and is also the thickest layer, right? And lastly, our endocardium is more of the inner layer and basically acts as a barrier between the blood and the heart muscle. Again, with that in mind, we can simplify this even more by saying that the pericarditis is an inflammation of the pericardium, which is the sac surrounding the heart, right? Myocarditis is an infection of the heart muscle, right? Because since it's the inner heart muscle, right? And lastly, endocarditis is referred to, like I mentioned before, an infection of the heart valves, right? So that makes everything more simple and more easier to remember. Now, I want to quickly go over important things to remember for your NCLEX exam. Now, one of the ways to diagnose our patient for potential pericarditis is assessing our patient for pain, right? But the problem with that is pain can usually also be associated with other conditions, right? So, one of the more important symptomatic assessment to diagnose our patient with a potential pericarditis is basically by looking for what we call the pericardial rub. Now, a pericardial rub, right, or it can also sometimes be called a pericardial friction rub, can be detected by obviously using a stethoscope. And basically, it's a sign of inflammation, right? So let me simplify more. Upon doing some auscultation with our patient, there is basically an extra heart sound, right? Aside from the typical systolic and diastolic, there would be an extra diastolic sound. So therefore, it becomes a three-component heart sound, right? Which means it would be a one systolic and two diastolics. Now, some textbooks would say that it resembles the sound of a squeaky leather, and sometimes it's also described as a grating, a scratching, or a rasping sound, okay? Now, this is it for now. Again, thank you so much, guys, for spending your time with me. I really do appreciate it, knowing that you have learned something that can hopefully make you pass your NCLEX exam. And if you do feel that you want to help support me with continuing with all these NCLEX videos, just please visit my website at www.allnursingnotes.com, and there's an NCLEX course in there that's available for everybody, and it has basically helped plenty of people, thousands and hundreds of NCLEX takers pass their exam. So again, thank you so much, guys, for spending your time with me. Good luck on your exams. I know you will do great, and God bless. Thank you. Hello everyone. Today we'll be talking about acute respiratory distress syndrome, or ARDS. Now, with acute respiratory distress syndrome, what occurs is that there's a fluid buildup in the tiny elastic air sacs in the lungs, which we call alveoli. Okay, and what occurs is that the fluid will keep the lungs from filling with enough air, which means less oxygen reaches the bloodstream, and in turn, this can deprive the organs of the oxygen that it needs, right, to function. Now, understand that ARDS typically occurs in people who are already critically ill or have a significant injury, okay? So let's try to look at the symptoms of this. Now, the signs and symptoms of ARDS can vary in intensity and basically depends on the cause and severity, okay? So the patient would be hypoxic and would show signs of SOB, or severe shortness of breath, okay? There would also be labored and rapid breathing, and there would be presence of crackles or rhonchi when we assess the patient. Also, the patient would have a low blood pressure and can somewhat be lethargic and confused, okay? Now, let's look at a few of the complications with ARDS. Now, if you have ARDS, you can develop other medical problems while in the hospital, and these problems can include blood clots, right? Because and understand that blood clots is very dangerous because it can lead to a pulmonary embolism, which is deadly. Also, they can be a problem. Another problem could be a collapsed lung, or what we call a pneumothorax. Therefore, in most ARDS cases, a ventilator is used to help with the oxygenation. And lastly, infections can also occur because the ventilator is attached directly to a tube inserted in the windpipe, and germs can get in and infect the lungs within this tube. Now, in regard to diagnosis, there's really no specific test to identify ARDS. The diagnosis is based on the physical exam, the chest X-ray, and various oxygen levels. Okay, now diagnosed with the X-ray, you would see a ground glass appearance within the lungs, and this is due to the fluid buildup around the lungs. Okay, the patient can also have a non-cardiogenic pulmonary edema, and obviously this is due to the excess fluid in the lungs. Okay, now the lab test will usually show a decrease in the overall oxygenation level throughout the body. Okay, now let's go to treatments. The first goal in treating a patient with ARDS is obviously to improve the levels of oxygenation in the blood. So because without oxygen, obviously the organs can't function properly. So there are various ways that we can give supplemental oxygen, and that includes mechanical ventilation. Now, the mechanical ventilator basically pushes air into the lungs and forces some of the fluid out of the air sacs, okay? And the most common, mainly more common mechanical ventilation would include PEEP, or what we call positive and expiratory pressure. And basically it's a method of ventilation in which the airway pressure is maintained above the atmospheric pressure, okay? And another method is CPAP, or a continuous positive airway pressure. Now with CPAP, it basically applies mild air pressure on a continuous basis to keep the airway continuously open, okay? Now that's it for now. Again, thank you so much for watching. I really do appreciate it. This one is just a quick review on ARDS, and I wish you the best with your NCLEX exam. Thank you so much, and God bless. Thank